I'm sorry I have to speak about the bad things, but bad things can happen. And again, this is the first time I'm going to present something, which is, I've been giving this lecture for 4 years and I'm updating it all the time when I get more patients. I'm actually the referrer in my area. When anybody gets a vascular complication, they send to me. And I used to think in my mind that this can never happen to me because I know what happened to me. So I'm going to present to you my sin, a vascular complication that just happened to me 3 weeks ago. I really do not understand why it happened, but again, the patient is safe. But let me begin. So again, here is my disclosure, nothing that. Filler adverse events, immediate and transient. These are all of them, and immediate persistent. These are procedural error. The one that is latent, just for you to know, the latent effects of any side effect is usually product related. The ones immediate are procedure related. Vascular compromise, yes, it is also procedure related. Now, it is due to the interruption or obstruction or compression of the vessel by the fillers. The symptoms are immediate prolonged blanching, but before that, pain. But the minute you enter the vessel, there is no pain. The pain is before entering the vessel. And it's like an electric kind of, the patient said there is an electric kind of feeling. And then there is no pain when you enter the vessel. Now, immediately there will be immediate whitening by the meaning of whitening. And then necrosis can begin to happen as early as 6 hours. How to prevent? Of course, listen to Sebastian. Okay, know your anatomy. This is number one. The glabella, the forehead, and the nose are the most dangerous areas because think about it, the vessels are really compressed in an area which they are not moving. There is no fat for them to move. This is one, but remember that there was reported cases of blindness from injection of the chin and the lips and the nasolabial fold. So it is not only these areas, and there is nothing called dangerous areas of the face. The whole face is dangerous. It's just that these areas are the most dangerous. If you are going to use needles, then always aspirate and wait. It's nonsense when you just aspirate and think. It takes really that, and we tried it. We want to publish that. It takes 1, 2, 3, 4, 5. You will get blood. Not before that. So take your time. You're injecting humans. I did all this, and it happened to me, by the way. But it's okay. Any severe sudden pain, stop, withdraw. Do not tell your patient, it's okay, it's okay. There is no okay. There is no okay. And if you have a fanatic patient, if you have this kind of women that we sometimes say that, when you're not doing anything, do not inject her in the first place. Because she will be like the wolf kind of story. If a problem happens, you will continue because she's frantic. So again, feel pain. When she feels pain, tells you stop, that's fine. But again, no, I'm feeling pain with nothing. Inject very, very slowly. No big boluses. So again, with all due respect to all speakers, when they say, oh, this is the sweet spot, and I go in and I push the 1 cc in that sweet spot, and they say, what is this? This is a huge bolus. Always small boluses where you want them to be. product should flow very, very smoothly. When you feel this plunger in your hand, a little bit of more pressure, stop. Something is wrong. You're not working in the right plane. No forcing of the product. And this is blood. So people who say that you cannot get blood in your syringe, no, I get it many times. So this is with Sculptra and this is with the hyaluronic acid. So you can get blood in your needle. Be careful of the nasolabials. The nasolabials is a very common thing to be done. And people think it's very, very easy. No. Remember, the facial artery and the angular artery is just going there, not on the bone, it's in the tissue. And also remember that it is very common now, one of the most common procedures that is done now is rhinoplasty. And there are people who have done more than one rhinoplasty. And these people are very dangerous because their vascularity has been compromised by their surgery. And so easily they can have a vascular compromise, and I'm going to show you one. Again, this is how our face is. It is bloody. And they're all communicating with each other. So take care when injecting. Okay, what happens if one suspects such an event? Immediately stop injecting, look at the skin. If it's white, then immediately get hot compresses, hot compresses, hot compresses, no cold compresses. Because I don't understand exactly why people apply cold compresses and ice injecting. You want edema or what? Why? What's the purpose? You can apply ice after laser, fine, but after injecting no ice whatsoever. Before injecting ice, because before injection it will give you a little bit of an aesthetic effect. But after injecting, it's nonsense. You will even get more of a hematoma if you apply ice after the procedure. Now again, nitroglycerin paste has been advocated, although there are papers that says, no, we do not use nitroglycerin. If you can massage the area, do a little bit of massaging to the area that you injected until you get the hyaluronidase. Inject the hyaluronidase as much as possible. There is no dose. I don't go with the dose. I go with how the skin will give me. Because remember, we have hyaluronic acids which are originally made not to get dissolved easily. So think of that. Not all hyaluronic acid will dissolve as soon as you apply or you inject the hyaluronidase. Aspirin, give aspirin 1 or 2 a day. It will help with the vascular compromise. I give my patient Viagra tablets for 3 days. Again, it's a vasodilator. Hyperbaric oxygen, if you have in your area, will also help. Anything that will help the patient, do it. This is just to summarize how to recognize the symptoms of the vascular compromise. And this is the first patient. Now with patients, no photos, please. Thank you. I am a Muslim coming from an Arab country. All these patients are wearing a hijab. Thank you very much. Okay. So, now this patient came to me with this first photo. She was injected. This is not vascular obstruction. This is most probably a vascular compression. She had 5 times rhinoplasty. She does not smell. Her vascularity here is nil. So the minute the doctor injected, this is a lawsuit. She filed a lawsuit against him. Because you know why? Not because of this. because when she phoned him, he was not compassionate. Remember Dr. Sykes' presentation? Hear your patient. When she tells you something, she filed him and she won. She got money. Okay, again, it's nothing. You could have passed easy if you could pick the phone and speak nicely to her. Okay, but this is it. This is few hours after the hyaluronidase. Next day, 48 hours, 5 days, and she completely healed. Another patient injected here on the dorsum of the nose. And when she went back to her doctor, she told her it's herpes. And then again, this patient, when she came to me with this after about 2-3 weeks, she said that for the first 2 days, her eyes was a little bit blurry, but she didn't think that it was a problem. Some patients are not that hyperfanatic, others are. So she was living with this with 1 week until she came to me. Another patient, her plastic surgeon told her it's an infection. He injected on the side of the nose 1 ml of TCL Ultra Deep, which is a great product, but you do not inject it here. And she had got this day 1, day 2, and of course it was very, very difficult to inject her, to inject the hyaluronidase in the nose. I did as much as we can, but again, day 3, day 3 this one, day 6, and then she sent me her photo, selfie, that she's fine and it's healed. If she's not been treated, she would have turned out to be like this. This is another lawsuit. Okay, this will need grafting. This will need grafting. So that there is no hyaluronidase that will help this, because the hyaluronidase is finished here. This is total necrosis, needs a graft, needs something else. And grafting from the scar there. Now this is my patient, this is my center. So patient came on the 27th of June 2018. She's a regular patient of mine. She came in for a dermapen. She usually comes for dermapen every 4 weeks. And then we had a leftover of her Restylane Vital Light. Restylane Vital Light is a very, very, very soft hyaluronic acid that I use sometimes for the teardrop when they don't need much. And she had a leftover which was injected 3 months ago, and I thought, me and her, that we will not need more under dye. So I told her after we finished, how about I inject you the rest as mesotherapy? And as I told you yesterday, I document everything. So this is my document, this is my nurses documenting. I injected the 0.5 of Restylane Vital Light just as mesotherapy. This is the way that we do our mesotherapy. It's just very, very superficial. Now on Saturday, she came to the office like this. Problem, I was out of the country. So I traveled on Thursday for a meeting, and Saturday my secretary is sending me this photo telling me AAMS is here and she's having an infection. Of course my secretary would not diagnose vascular. Now during injection, was there any pain? No. Was there any blanching? No. Was there anything that happened abnormal? No. Everything was going on normal, and she has originally a reddish face, a little bit. She gets more red with any procedure. I called the patient afterwards in my office, and I told her, when did this begin? By the way, I usually never ever give my private phone to any patient. I have another cell phone in the office, but my private is never with anybody. But for her, I gave her my private number. Okay, so I gave her my private number, and I told her, when did this happen? She said, it was read on Wednesday, but Thursday, it started to get a little bit looking weird. And then it's increasing, and there is pressure and pain. Is it an infection? I got it. Okay, no problem. Now, I instructed my nurses. I don't have anybody to inject in my office except me. So I instructed my nurses to put for her hot compresses, little bit of massage, to take an antibiotic as prophylactic, and aspirin. And I was started thinking what I'm going to do. I'll be in the office on Tuesday. It's Saturday. She cannot wait. So, good for me, and this is another tip. Know a doctor, a colleague in your country that you can refer your patients to, if this happens. So I phoned my friend who, you see the vesicles here, shows and this is a whole compartment. This is a whole compartment, and I really have no idea. I have an idea, but I'm going to tell you about it. But why all this from just a tiny injection? This is directly after she was injected by my colleague. 150 units of hyaluronidase. So this is the same day, 30th of June. 1st of June, she came into the office. I made her come into the office every day to check how she is or to send her photos. And this is the 3rd. This is the day I saw her, the day I was in the office. So yes, she's improving. Again, day 8. Now, as the patient improved, I start thinking, what went wrong? Why did it happen? And this is on the 9th, and this is on the 15th. Okay, so everything went on. The patient is mine. When she enters the office, I told her, you are my sin in life. And we laughed about it and said, okay, doctor, it's all with God, and I'm fine. You treated me, and it's okay. So again, if you get a complication, be compassionate to the patient, and let her know that you're with her. Okay, so that she will not go against you. This is a very important thing. The second thing, if you're a traveler like most of us, have somebody who can cover you up, because she would have not waited until I went, it would have been totally black. Okay, the third thing, what went wrong? I think that what went wrong was that I usually, when I inject Restylane Vital Light, I inject it with a cannula, a 25 gauge cannula under the arm. And this was the leftover. Okay, but the nurses gave me at that time the needle. I was injecting it here, and I used the 30 gauge needle. Now 30 gauge needles cannot aspirate blood. And that's why I don't like to use them a lot. But maybe this is the reason that I was in a blood vessel. But because of the 30 gauge needle, I could not get the blood in. And because the Restylane Vital Light is at 12 mg, it's very, very soft. So it entered the blood vessel. Daniel, do you have, after I finish, do you have any, why did this happen? Anyway, so never say it can never happen to me. Okay, because maybe God is punishing me, because I used to say this. This is a stupid doctor who did this, you know, that. But no, never say it can never happen. So let's go. Retinal artery thrombosis, our total fear. Yes, just 2 minutes. In the literature, up till 2015, there were 98 cases of blindness. I think it is maybe doubled or tripled by now. We don't have records, especially from Asia. There are a lot of cases from, mostly it was, before it was autologous fat, but again, now maybe hyaluronic acid will have a good effect. Now, it has been explained, you are injecting, the patient feels pain, but you're pushing, and you are into the tributaries of the retinal artery. You go in and you start pushing very hard. You know why you're pushing very hard? Because you're against your systolic blood pressure. You're pushing hard, but you're pushing very hard. And then you continue on pushing very hard, and nothing happens until now. The minute that you withdraw your needle, there is total blackness. The first time I heard about blindness from hyaluronic acid, it was in the MCAS. Remember, Danny, when you were the chair? And the unfortunate doctor who this had happened with her in the UK was courageable enough to come up in the podium and tell us what happened. And it's weird because she said that the patient was in severe pain. So pain is a no-no with injection. So do not give a patient local anesthesia to protect him from pain. No, because even in the lips, they should not feel that much pain. That's very important to know, because pain is very... Now, again, pain, this is... time here is very crucial. 90 minutes and the retina is done, finished. That's the maximum, 90 minutes. And this is how it is. The retrobulbar. This was published in Dermatological Surgery. Please read it. When they injected in the supraorbital notch, and they say that they regain the vision. But again, if you see the commentary on this paper, it's hilarious. They turned the paper upside down and said that what was done was nonsense. But again, it's a way to help a patient if we need to. And please read this paper. It's on the consensus of the hyaluronic acid filler complications. And I wish you all safe procedures, but if you cannot diagnose a vascular compromise from a hematoma, from an infection, do not hold the needle. Okay, thank you.
Thank you, Dr. Sahar. With this, we end this, but the take-home message is that the right knowledge of anatomy, right technique, and if the patient has pain, please be compassionate and withdraw your procedure and see what and where it went wrong. So Dr. Perry has been telling us right technique, right technique, right technique. Any questions from the presenters? Okay. Now we would go